to introduce our morning featured panel, which is Breaking Barriers, Addressing Social Determinants of Health to Advance Generational Wealth. We have an esteemed group of leaders on our panel this morning, including Dale Anglin, Director of Press Forward, Dr. Michael Baston, who probably needs no introduction, but President of Cuyahoga Community College, Dr. Airica Steed, who also probably doesn't need much introduction, who is the President and CEO of the MetroHealth System, my colleague on the AAPC and President and CEO of Birthing Beautiful Communities, Ms. Jazmin Long, and she's going to moderate the conversation. So now I'm going to turn it over to Jazmin to kick off the conversation and invite the panel to the stage. So thank you, everyone, and enjoy.
All right, good morning, everyone.
Good morning.
All right, so I've kind of,
I hope that's not me.
We're going to have a really good, real raw conversation here with you this morning with my colleagues. When asked about the purpose of this summit, Connie Hill-Johnson, right there, said that this theme speaks to a legacy of leadership and generosity passed down through generations. With that, and building on that framework, this panel is centered on addressing the social determinants of health. Some of us call them the social drivers of health. However you're looking at that framework. Dr. Steed, we know that health is wealth. How do you see your work at Metro building out philanthropic efforts for the Black community?
Well, first of all, I'm so honored and humbled to be here today to really talk on a topic that is very near and dear to my heart, and I can talk all day about this topic, really. I think healthcare plays a pivotal role in this conversation, and oftentimes I'm quoted on really emphasizing I'm here to lift both the health and the wealth of our communities, and truly you cannot separate those two dynamics. Your health is your wealth is your health. And we all know the devastating statistics out there. Black Americans, unfortunately, are suffering from poverty. More than 50% of our children right now in Greater Cleveland are living in poverty. So unfortunately, just by nature of being born, they were given the short end of the stick. And unfortunately, when we think about healthcare, there are factors well beyond healthcare that demonstrate how long we're going to live, unfortunately. And there's two telltale signs of life expectancy, and they have nothing to do with healthcare at all. Education and poverty are the two telltale signs and symptoms of how long you're going to live. And unfortunately, 20 years of your life is already taken away if we cannot lift up education and we cannot address the poverty issues that we're having out here. And unfortunately, Black Americans suffer more and die more needlessly due to education and poverty. We suffer from every level of chronic disease out there, from mental health issues to kidney failure, to hypertension, to diabetes, to stroke, you name it, just because of where you come from and your status. So in order to really address and truly eradicate healthcare disparities, we have to eradicate wealth disparities. So this is not just about healthcare, it's about wealth care. So in essence, the overall goal is to really step above and beyond the four walls of the hospital system, and this is why I'm so proud of the work that MetroHealth is doing. I heard the calling all the way in Chicago, and now I'm here. So this is now my hometown, where MetroHealth has been investing in. So we are philanthropic at heart of what we do to really address these plaguing disparities. And again, they're wealth disparities and their health disparities. But in order to really drive the solution on this, we have to focus on both. So we have to invest in housing. We have to invest in education. We have to invest in small-owned, minority-owned businesses. We have to invest in digital connectivity. We have to address the plaguing levels of hopelessness that is out there that was a pandemic well before the COVID pandemic. So in essence, we need to have this conversation as a fluid conversation, but unfortunately, we're not going to be able to crack this nut until we address the wealth issues.
Thank you so much for that. Along those lines, Dr. Baston, can you talk about how your work at the college is providing new opportunities, unexpected opportunities for wealth building in our communities? And I've often heard you talk about the gig economy, and I've been connecting with people at your team about the ways that you are trying to support entrepreneurship. When we look at this new model of gig economy work, entrepreneurship in the Black community, how is Tri-C supporting that?
Well, first, let me thank you all for being in our home. This is Tri-C as well. And it is important for us to recognize that, as Dr. Steed said, if you do not have a quality education, you cannot have the opportunities to move yourself and your family up the economic ladder. What we know is that many in our community are not aware of opportunities. And if you are not aware of the opportunities and there's no one assisting you to connect to the opportunities, then how can we expect your ambitions to be raised? Mm-hmm. Your proximity to what's possible is on the basis of what you know. Yes. And so if all you see is limits, why would you believe that there's anything beyond the limitations? So it is important for us to continue to use education as a vehicle to move people forward. And not just simply the formal education of a degree or even a certificate, but so many young people in America today and in our community specifically desire to design their own destiny. And that is why we have built out a very strong entrepreneurship program here at this college, because we want those in our community to recognize that if we appropriately resource their hopes and dreams, and if we enable them to build momentum in terms of the kinds of things that they're trying to do, we know that can shift them economically. So many of our grandparents and great-grandparents who never got a chance to go to school took it upon themselves to work hard so that the next generation could go to school, so that future generations could take that knowledge, not just of the hard work, but the advantages that come through a quality education, to transform multiple generations and to build a legacy. And so when I think of the gig worker, that person who is side hustling, that person who has these multiple jobs, it is not necessarily that they want to do that, but they do it as a strategy to build their destiny, design their future. And we've got to lean in, educational institutions, our partners. I mean, MetroHealth and I, we partner in so many different ways because we recognize that health and wealth and education are critical to multiple generations of opportunity. Too many folks in our community are on the outside of the opportunity ecosystem, and their nose is pressed against the glass, not knowing how to actually get in.
Thank you. Dale, I am so excited to be here with you, and congratulations for your new role. When we planned this panel months ago, you were still in your previous role at the Cleveland Foundation, but for me, there was such an importance to have you here and to talk about democracy building. I have my colleague, Airica Anthony, right here, who has spent a lot of time really focusing on the importance of reliable information and what that means. And so I think there's a really great tie here. Can you speak to how access to reliable information and democracy plays a role in wealth building?
Thank you. I'm actually going to pick up from where Dr. Baston left off, that you have to have knowledge. You have to have information in order to do almost anything. I'm really proud to be the first inaugural director of Press Forward. We are a donor collaborative. We've pledged over $500 million, and we're trying to double that over the next 5 years to support more and better local news. And why local news is important is because it turns out when we don't have local news, there's more polarization, there's less government oversight. When you do have local news, there's more community building, there's more community empowerment, and we know this because we've now studied this for the last 15 years. It's empirical evidence. The question is, we've got the ad revenues that used to support our local news have gone away, or they've decreased a lot. And so we're using philanthropy and many other means, subscriptions and memberships and events in order to support these local news sources. I hope you guys are reading Signal. I got involved with this work with the Cleveland Foundation, helping create Signal with my partners at St. Luke's and other places. It's now a year and a half old, and what's interesting is when you read Signal these days, the days when our website traffic is the most is often when we report on healthcare. It is often when we report on quality of life decisions like abandoned properties and what happens with them. It's not that people don't want the information, they just haven't gotten it in the way that they want to get it. It's not always, by the way, text. It can be video. We just understand that at Press Forward, we're trying to do what we did here in Signal in Ohio. We're now, by the way, in Akron, we're in Cincinnati. We're going to be in Lorain and Columbus soon. We want to do that same thing all over the country. That's my job, is to help raise that money, deploy those dollars, and support that work. But what I also want to say is that we also understand that information is power. In the end, that's what's important. That power is important for our community. It's important for reliable information. Without that, we don't know how to utilize bank services or how to save or invest. We don't know where to get good health care or what questions to ask. So many things rely, it's just, you think of information almost like water. You assume it's always going to be there. But it's not always going to be there unless we figure out a way to invest in it and support it. So I get people asking me, why do I need to support Signal? We all need to pay for local news now, unfortunately. You pay for the arts. You pay for healthcare. Every nonprofit ecosystem that we have includes a philanthropic aspect to it. So now journalism needs that. So that's my pitch, by the way, for journalism. Not just Signal. We have the Buckeye Flame. We have the Marshall Project. I'm not just about Signal, even though I am on that board still. But it's just important. And I think we thought we would always have that and not have to support it, and now we all have to support it. Last thing I just want to say is that in Ohio in particular, information is so important. We are a gerrymandered state. We have a opportunity this year to fix that. I'm not going to say how you should vote. I'm just going to say you should pay attention to the issue. Without the proper information in the way you want to receive it, in the time frame you want to receive it, our communities will not be able to make the progress that we need them to make.
Okay, our time is absolutely flying by.
Oh, boy.
Dr. Steed, I'm going to ask you a big question. I want to know from your perspective, what is the role of healthcare in closing the wealth gap?
Well, as indicated, I'm making a very bold move because I believe that in order to close the health gap that is out there, and I've been really steadfast in saying from my onset that I'm here to zero out the death gap in this community. And I want to take that above and beyond Cleveland. I actually want to nationalize that. I want to globalize that. It is unacceptable that we have been suffering for centuries and dying for centuries, just needlessly and unacceptably. And I strongly believe that the wealth gap is a major contributor to that. So I cannot adequately solve zeroing out the death gap and eradicating healthcare disparities without eradicating wealth disparities. They go hand in glove. They are married together. So with that being said, we're making a bold move on this. So all of our efforts are incorporated with a spirit of partnership. My brother over here already indicated how we're holding hands through this cause. No single healthcare system, no single individual, no single policy created the problems that we're having. So we absolutely need to get out of our own way, check our titles and our egos at the door, and really partner boldly on this mission. But I truly believe that healthcare has a huge place in all of this. So again, more than 80% of what we can impact on health and wealth lives outside the four walls of a healthcare system. They actually live in our communities. So this is a community problem. This is also a community opportunity, right? So I'm here to take my title off, get heavily in the trenches. I'm right here with you. I'm having these conversations for a reason. In order to solve the wealth problems, we're going to have to get proximate with the community and really intimately understand the challenges that we're grappling with. So as I'm looking to solve for how to get diabetes in control, I'm also trying to determine how I can get the poverty levels in control for our children. More than 50% of them are living in poverty. So how do we solve for that? Because if we don't solve for that, we're going to stay on this hamster wheel. So with that being said, it is a huge aspect of our purpose. We're addressing transportation barriers. We're addressing housing issues. We're addressing all kinds of issues that relate to this challenge overall.
Dr. Baston, we are all, we have our titles, but I love what you just said to take them off, right? Because at the end of the day, we are still all Black people. Well, this is the African American Philanthropy Summit, and we've spent a lot of time talking about the role that philanthropy plays in the Black community. So from your perspective, and you can talk about Tri-C, you can talk about your work in the church, whatever you want to make it, what is unique about Black philanthropy to you?
Well, think about it now. You mentioned about the church. I am a pastor as well. And I can tell you one lesson we learned in the Black church. The church don't have a job. Only have what you give it. And so for churches to be vibrant, it relies on people to make an investment. You make an investment in the ministry so that whatever you're going through in your life, that is the time the ministry makes an investment in you. So we really believe in this idea that we should recognize the importance of reaping and sowing. If you don't sow, you can't reap. And so when we make an investment through our philanthropic support, it's not benevolence. It is investing in ourselves. And I understand, I know this is not a church service, but I encourage all of you that are involved, particularly with Black people in the Black community, that we can't be weary in well-doing. Because in due season, we will reap if we faint not.
Okay, well, I didn't know we was having church on Thursday. Okay, amen. See, we're family up here, so it feels good. Dale, I'm going to take a little liberty and not ask the question that I wrote, and I'm going to ask you just a question. Again, thinking about the work that you have done at the foundation, I think it would be remiss to not talk about the role. We have so many nonprofits in town. We have so many people trying to solve for all these issues. In your work, what has been the role, what is the role of philanthropy in all of this?
Yeah, so I think what I've learned is that philanthropy is a tool. And it is a tool for bringing people together. What I always have learned in my 18 years of philanthropy, I never thought I'd be in there that long, is that one thing philanthropy can do is get people to a table, keep them at that table, so that we can jointly come up with a solution. It is not about just what's in the program officer's head. People closest to the problem are closest to the solution. Our job is to figure out how to get you together, and us with staff at the foundations and with donors, to think through, because these are complicated issues we have now. No one organization will fix them. No one institution or person will fix them. We have to work together. Philanthropy has to work with government. We're not good at always working with government. We have to learn government speak. We have to learn government timing. It's different than philanthropy timing. So to me, philanthropy, I've been privileged and to work in philanthropy as a way to connect people and connect issues. All these things are intersectional. Yeah. there's literally, we could, sometimes when things came into the Cleveland Foundation, we would choose what bucket you put it in. It could be in 3 buckets. The point is, we need to think through, I tell people these days, I don't want to hear the first question, I want to hear the 5th question. The first question only gets to surface. The 5th and the 10th question gets to detail and what is the real problem we are trying to solve. I hope that my work at the Cleveland Foundation, I miss that team so much. I'm learning. I really do miss you after being now with other foundations. You know, I'm so proud to be there because they've done so well for so many years. I just stepped into that role of being in the community, thinking long-term and short-term at the same time, inviting people to be staffers who were on the ground always, not inviting people to be staffers who've been only in philanthropy. And so, you know, I just think it's going to continue to do incredible work under the new CEO, Ms. Lillian Curry. But just remember, philanthropy just has the dollars. We all have those solutions. We just have to figure out ways to get together and share what we know, our knowledge, our resources, our time, our talent, and treasure to figure out how to solve some of these things. The last thing I want to say is I'm so proud of this particular summit and the work you all do. Black people have been at the forefront of every movement possible in the last 100 years. We help set the standard. We are leading when other people are like, wait, what? We're like, no, we're going to go there. You all continue to do that. I really encourage us to continue to do that because the world has only gotten more complicated, not less.
Can we give it up for our panelists? Okay, so now is the time for our Q&A, and I'm looking around because there are 2 microphones somewhere. Are they microphones? Okay. Do we have questions for our panelists? Ron?
Thank you. So good morning, and thanks to our panelists. Wonderful, wonderful perspectives. So I don't know if this is a provocative question or not, and since Dr. Steed, you said you're going to take your CEO hat off, the question is this, especially to all of you, but especially to our transplants. You guys have been here a couple of years now or less, and so when you think about the partnerships and you think about the problem, what are some observations about challenges that we ought to be thinking about? And so, you know, because all of us are sitting here, you know, commiserating with you, and we agree with you, but there's probably some fundamental things that we're missing that we need to focus on.
Yeah. I'm looking at my brother over here.
Because, you know, I talk about this all the time. I am from New York. And now I'm really a Clevelander at heart. I really love Cleveland. Come on, y'all better celebrate Cleveland up in here today.
Yes.
I want to give you a secret. Cleveland is probably the best resourced community that deals with the greatest poverty issues. There are no resources like what happens in Cleveland in New York. There's no conversations in New York in the way it's in Cleveland. The difference is that everybody is working on different aspects of the problem, but too much of the work is about participation and not about transformation. So we actually are currently funding same levels of participation. Our funding strategies are not always about the actual impact. So if you don't have impact-oriented strategies and you're funding participation, how can you expect transformation? And the fact is, we have a lot of folks looking at the same problem a different way instead of saying, hey, let me utilize my resources for this aspect, you utilize your resources for this aspect, so that we can have a cumulative effect of this outcome. There are not set outcomes here in this community around topics and then making sure that we're monitoring the progress. What we are monitoring is participation. And if participation is the standard, then we're doing well, because we're saying the same amount of people last year, now we got the same amount of people this year. But Are we increasing home ownership? Are we increasing entrepreneurship? Are we actually getting people to live in homes that they buy and renovate? Are we actually getting more young people educated? Are we doing the things that actually translate into true economic mobility? Or are we celebrating that we're able to help more people, but does the help help?
Right. Right.
And that is not a question, from my observation, that is not the critical question that's always asked here. We feel somewhat benevolent. Let's help people because people need help. But if your help is not getting them to not need you anymore, is your help helping? So that's sort of what I see. And that's, just saying. But we can do better. And I think, Airica and I talked all the time, New York, Chicago, now we Clevelanders. We talk all the time about, we don't just want to engage together so that we can pacify people, that we can medicate people, we can give people the impression that they're not dead so they're better. We actually want people to thrive. We don't want family-sustaining wages in this community. We want family-thriving wages. Who just wants to be sustained? So that's what our partnerships are about, like how do we move people from here to here? How do we put people in a place where they need different services from her and not emergency services from her? That's where we're coming from.
And wait, and I gotta follow you? What you just said. Honestly, I think we're standing in our own way in this community. I really do. I'm so proud to be a part of the Cleveland communities. But what I see is a level of redundancy that we just need to stop. We are standing in our own way. And that's why I made the point of saying, let's check our titles at the door. It really doesn't matter what role we play. But at the end of the day, what really matters is the impact that we make and the legacy that we leave at the end of the day. Look at this room right now. This room right now speaks volumes of possibility. And I think that we are a sleeping giant across the United States. So the 50% poverty levels that's real should not be with the power in this room. So that the possibility is truly possible. And we can make possible out of impossible. And I've seen it. But we have to get out of our own way, and we have to connect all of these dots. And we need to galvanize around that possibility. I have endless hope, but let's just stop having conversation and let's make action happen.
Let me just say one more thing. I'm sorry. I'm gonna get right back to you. But what I notice here, 30 seconds. What I notice is that we have a tendency to engage in tactics and presume that tactics are a strategy. I think that we have a lot of tactics here. All the different organizations and everybody's tactical, but it is not strategic. And I think at this part of Cleveland's evolution, strategy has to be the goal.
Let me say one more thing.
Oh, go ahead.
And I'm looking at the title of our panel.
Yes.
Advance generational wealth.
Right.
I think what is missing is scalability. We're not scaling. So I think that we are proving in pockets and puddles. Let's make a tsunami wave.
And I'll just add that I think, working on a panel with these two, wow. I'll just add, because I got a plug for supporting our young people. Yes. You're not going to get to any of this unless we talk about our young people.
That's right.
And so I just want to make a plug that, and I don't mean just in our education systems, in our out-of-school time systems, of course that's all important. How are you all talking to young people? Do you have a young person in your life? Not your child.
Yeah.
You're supporting your child. I assume you're supporting your child. But a lot of our young people are isolated.
Yeah.
They don't see adults in suits.
Yeah.
We talked to a young person a year or so ago who said when the person, a male in a suit came to their neighborhood, they thought he was the mayor because they didn't see anybody in suits. We are too isolated from them in Cleveland. We have got to figure out a way. I know many of you, I'll thank you already for being mentors. I know some of you already are through Say Yes and other means. We just got to do more. I'm just letting you know, we have to do more. We will be fine. They will not.
Yeah.
Especially since COVID.
Yeah.
Please, 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 if you are in a room with the young people, talk to them. I am in rooms with adults and young people where the young people are off on one side and the adults are on another. They want to talk to you.
Yeah.
They need to hear from you. Please find a program. There are tons of them out there. Volunteer your time. Learn how to talk to young people. They're not easy to talk to. Michelle Scott Taylor will tell you that. Nikki Price will tell you that. If someone tells me, I don't need any more training, I've got this, I've talked with young people all my life, I am worried. Young people change every day.
Yeah. Yeah.
So we all need to learn I'm trying to learn new terms all the time with my young people. Please, I am begging you, we will not win this unless we figure out how to talk with them before they are 18. And I mean starting with them when they are 2. I learned the term over the weekend, juicy conversations, juicy words. 1-year-olds, 2-year-olds need you to use words that they do not understand because they will figure it out on themselves, on their own. Please, 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 that's why I just put the plug in for that.
Thank you. Thank you.
We have one.
Hello, thank you for all of the information, and special hello to my president, Dr. Michael Baston of Cuyahoga Community College. Everything that we're speaking about is great. I guess I would ask the panel, when we look at African American philanthropy and special recognition to the committee that has existed almost 20 years, what can we do to educate our community and inform them with respect? The summit is every 2 years, but there's still lack of information for those that want to move the needle as far as healthcare and education to the African American community. How can we do that as change agents, including our leaders, such as all of you on the panel? So more of a comment, and then when we look at multi-generations, it is only at this time where a summit is given that we hear about African American philanthropy. And when we look at other cultures, like the Jewish culture, they have foundation, they have wealth. So saying a lot, but what can we do to know where do we go to? Unless you have that connection with our amazing leaders leading this effort, where do we go to, and how do we know as far as philanthropy resources to go for support? So thank you.
Thank you.
Yeah.
Okay, I'll start. There are a number so you had multiple questions in there, but there are a number of, I would say, places that help you if you want to give money. There's no shortage of nonprofits in Cleveland. And there are places, not just the Cleveland Foundation, but others, I think the people who make up this committee, who can give you suggestions and that kind of stuff, right? If you want to raise money, I think there's so many things now happening with black investment pools and people giving circles. In fact, we probably invented giving circles in the black community a long, long time ago. Now it's a thing. This is why I say information is important. We are also disconnected.
Yeah.
So if you are only in, for example, the banking industry and you only know banking people, you need to find a way to know the people in the nonprofit sector, right? Because they may have information that you need as a person who wants to just give in the community. That's something the Cleveland Foundation, I will say, can help with. They have a lot of knowledge in all the staff members' heads. But I will say we've got to get out of our silos, our personal silos. I don't want to be in a room with just nonprofit people, or just corporate people, or just people on the east side, or just people on the west side, by the way. We do that too. So I'm always trying to figure out how to expand my universe, and I think that's one of the things we should be thinking about, because with that comes other information that will help you figure out where to give or how to raise dollars.
Just to add to this, and as I take a couple steps back and really think about the conversation that we're having, I think about it from the context of we're already winning, right? So look at the historical levels. African Americans contribute 25% more than any other group across America, right? So historically, we're already winning, we're already ahead. The question is, how do we advance that? How do we really uplift that? And I think that we need to provide, cast a wide net of knowledge and information to understand how to continue to move us forward. But at the end of the day, there's more ways than just dollar value of giving, right? So giving our time and our service and our knowledge is a way of giving. But at the end of the day, and to the points raised, I think that we need to figure out a way to galvanize, because I think we have so many different pockets, and those pockets are not going to allow us to progress to the level that we need to progress. We need to figure out a way to bring all of this together and culminate this to really have the impact, not of participation, but truly have the impact where we're actually moving that needle to eradicating this significant wealth gap that exists throughout our communities. And that wealth gap is contributing to the life expectancy gap that we're actually seeing. So I think that that's part and parcel what we need to address. I think forums like this are power. We just need to figure out a way to continue the conversation.
And certainly it's about getting the information out to the people. That is a concern. In my community, quite frankly, we got susus. So we basically, everybody pay in,
right.
and then instead of us taking a big loan on something, we're in a big susu where everybody contributes every week, but now I'm not paying any debt on a big purchase I have, but I'm paying it off on time from my own money, being disciplined about payments. Now, some of y'all may have never heard, how many of y'all heard of a susu before? Wave your hand. Like, so there's a lot of people that don't even know. In the black community, we got susus going on in hair salons and barbershops where we are keeping black wealth in the community. But there are more strategies other than just the susu, because there's some folks in our community that's all they know in terms of generating additional wealth. So it is making sure that people have access to the strategies that then they can pass down to their children so that they can engage and create that generational wealth. Now, some of y'all gonna Google when y'all leave, y'all look for susu. but that's from the hood. That's hood economics, quite frankly.
right.
I think it's very good to go to all of the fancy school, but hood economics is that you want to buy a car, you want to buy a house, you get into a big enough susu so you can pay cash, and then you are disciplined paying every week, because somebody gets the pot this week, somebody gets the pot that week. So don't think that the traditional structures are not happening in the black community. We got lots of ways to make money in the black community. We don't have all the information about the different types of strategies, and then we're not being taught how to then translate that into helping others develop that generational wealth.
We are well over time, but I am going to let you all have a closing thought. And my two down here leadership Cleveland classmates, please keep it short. So that we get invited back. So we keep it short so we get invited back. Go ahead.
Wait a minute. Now you got us speechless.
I should have told us to be quiet.
Exactly. I just got hushed.
Okay, so I'll just say both of my kids are at HBCUs. One graduated from Spelman 2 years ago, and I got a college graduation in May. Thank you very much.
Woo-woo. Thank you.
We know the power of black philanthropy just from those HBCUs.
Yeah.
I see it every time I visit them. They would not exist if it weren't for the power of this group. I'm just letting you know, so thank you very much.
Yeah.
We know how to support each other. Yeah. We've done it many, many times before when people did not come to our rescue. We cannot wait for others to rescue us.
Yep.
Yep. We know how to rescue ourselves. We do have to come together and have the right information to do it. Don't let the craziness that is happening right now, the going back in time that we never thought would happen this fast, deter you. There is a chilling effect that is happening now that is crazy. We know they are doing it because we are so close. Let's remember that. Remember our history.
Yep.
Know that we can overcome this craziness too.
I'm going to keep mine brief because my sister's over here looking at me. Momentum truly begins with a moment. And let's take advantage of this moment. And let's take our lives back, please. Let's take our lives back because we matter. Our lives do matter. And the conversation that we're having is all about saving lives. So I'm just going to keep it brief and keep it at that.
Thank you.
If it's going to be, it's up to me. If it's going to be, it's up to each of us to lean in, to help out, to make it happen. Tri-C's always been the place where futures begin, but now we are the place telling folks to own your future. Today, in this experience of these next few hours, help us own the future of our community. Thank you.
Thank you all so very much. Thank you. Thank you.